And that, I think, brings us very nicely onto what we're here to discuss, which is, of course, a subject that many of you and many of us here in the world are paying very special attention to because it touches so many lives and in very different ways. Whether we're talking about green, whether we're talking about climate change, whether we're talking about sustainability as a whole. But underpinning that, what then happens to our healthcare facilities, and more so what happens to us as people within that space. I'm James Chan, the WHO Goodwill Ambassador for SDGs and Health. And today what we're going to do for you is to bring you a couple of speakers who are going to set the stage, who are going to provide some of the technical input on what WHO is doing on this front. We're going to move to a moderated discussion, and we're going to try and keep that a little bit liquid. Those of you who were here yesterday saw that we had about 30 inputs on the floor. We really made this room come alive with all of your voices. So if the SDGs is talking about leaving no one behind, let's try and make sure that the next 105 minutes leaves none of you behind at least. Welcome also to our audience joining by live stream, and everything can be understood through the simultaneous interpretation which is available in the 6 official UN languages. The Director General, Dr. Ted Rose, will be joining us at some point throughout this meeting. So what I'm going to do is to ask the newest regional Director of the WHO, Dr. Takeshi Kasai, who oversees Western Pacific, the 37 countries and areas in that region, the one that is prone to natural disasters, the region that holds the Pacific Island states in its hands. But more personally, and I've known him for a number of years, Dr. Kasai is so eager to identify the solutions that he sees on the grounds. He's been a witness to many of the problems that he's seen on the grounds. Dr. Kasai, you've just passed and just celebrated, I hope, your first 100 days in office. Many congratulations, and please share with us what you're learning when you're on the ground, when you meet the people.
Thank you very much, James. When you say that day one was a long time ago, how can I disagree? I feel a long, long time ago. Honorable ministers, distinguished guests, ladies and gentlemen, colleagues, good afternoon. I am really happy to attend this technical briefing because, as James said, our region is one of the most disaster-prone regions. 8 out of 15 high-risk countries for the natural disaster exist in our region. And I am very keen to learn because half of my member states is from the Pacific Island countries, which they contribute smallest carbon footprint, yet they bear the biggest burden. And I'm really eager to find a solution because I've seen the real impact on the ground. Earlier this year, within my few weeks as a regional director, I had the opportunity to visit the Kiribati. Kiribati is the small island Pacific island countries in the Pacific with 100,000 population. It's really middle in the ocean. It's small, but actually big, with the 3.5 million square meters. To give you the sense, that is bigger than India. And I had the privilege to take a boat from their capital island and then to go to a small island called Ibai. And I went to the site where church stood in front of the beautiful coastal line, but behind there's a lagoon with the seawater, and there's no houses around. And on the way back, one of my staff was very quiet. My staff, Agnes, was very quiet. So I asked, what happened, Agnes? And then she started to talk very softly. She said that that's the village I was born. That's the village my grandfather, grandmother, and the father and mother was living, and that's the village she was born, but that's washed away. This analogy might sound a bit strange, but when we involve in the measles outbreak, you often see a very sad scene, babies dying or the parents distressed. And I always have the sense of regret and eager to find some solution not to repeat this again. And I'm very happy to have these sessions because I see this green and the sustainable and the climate resilient hospital could provide one of the solutions to what I'm looking for to offer to those reality on the ground. In the Western Pacific region, we're working very hard in collaboration with many partners to support countries to build climate-resilient healthcare facilities in line with the Pacific Island Actions Plan on Climate Change endorsed by the Pacific leaders launched at the Assembly last year. But I learned this concept is going further because it's not just resilient to the climate change, but to be green. And I received a briefing from my staff that some of the countries, actually the health sectors are contributing more than 10% of the carbon footprint. And I think it's now the time, not health sector, think about the climate adaptation, but it's also to think about the contributing to the mitigation. But I had also the opportunity after I became the regional director to visit the American region, the PAHO. And I learned their concept is even ahead. So combine this climate resilience and green, but they wanted to even use that opportunity to make hospitals smart, means efficient and sustainable. And I learned that there are many things that I should learn. If you have any questions, don't come to me, but I have a colleague from PAHO Zero, so I'm sure he can answer if you have any questions. But in conclusion, I'm very excited to be here, and I'm sure you have the same feeling. It's now time for us to really find a solution, practical solutions to the long discussions on the climate change, but to be combined and taking the opportunity for other green and find some solutions of the smart hospitals. So I'm very much looking forward, and thank you very much, James, for this opportunity.
I would like to ask you one question.
Was that in the scenario?
No, it's not in the scenario. But I'm sure that when you think about Agnes, that wasn't in anyone's plan. It was a very emotional way for you to share the work that you do in Western Pacific, and many people are going to be excited about what you're going to do next over the next couple of years. What can you do to prevent those stories from reoccurring, given that nature is so strong, given that we're dealing with the realities of climate change?
I think I wanted to answer in this way. I use Agnes, who was with me and who was with who is actually my staff. But Agnes is everybody in the Pacific Island countries, and the Pacific Island countries are really, really looking for some practical solutions. Still, they are interested in continue to advocate that the health sector to have proper recognitions in these discussions at the global level, but they're also looking for some practical solutions on the ground. Easy to say, but not easy to offer such a solutions. And I've been looking for what kind of things I can offer. And I found this topic, green and smart and climate resilient hospital, can be one of a very powerful answer. And in the coming 5 years, this is something that I'm also interested in continue to pursue in the Pacific Island countries. But I have shared in my intro speech that I learned that in PAHO, particularly in Caribbean country, this concept has continued to evolve. And if I may, taking over to some of the panelists' speech, I apologize, but there are already 400 examples and producing many good evidence already. So I'm very much keen to learn, and then if it's possible, I wanted to implement also this region.
Thank you very much. So keeping that story and the intent and that spirit of that as we go forward, thank you to Dr. Kasai. Let's move now to Dr. Maria Nehira, who for the last since 2005, has been in her role as the director of the Department of Public Health, Environmental and Social Determinants of Health here at WHO. She is one of the world's most influential figures on climate policy for the profile that she lends on advocacy and also on awareness on health, climate, and air pollution. Dr. Nera is a specialist in endocrinology and metabolic diseases. And what she's going to do now is to share with us what is at stake when we talk about green, sustainable, and climate resilient healthcare facilities today. Dr. Nera.
Thank you very much, Chair, and thanks, distinguished panelists and participants, for still being with us on Friday, last day, and I'm sure exhausted, but still, trying to focus on something that is extremely important. Our regional director was saying it very well. If there is one role, is to raise the voice of the health sector for actions to be taken to mitigate the causes of climate change. I mean, the voice of the health sector can be the one that changes completely. Here we are talking about humans. We are talking about putting at risk the health of the people. Therefore, our voice needs to be extremely, extremely powerful. But of course, let's start by our own business. And those are our own business. We need to look at how we put in the center the healthcare facilities. We are looking, as you know, in our transformation and putting the healthier population, universal health coverage, and emergency. But in the middle of all of that, we have our own healthcare unit, our hospitals, where we have a comparative advantage where we have a very important role to play. And this will be the dream for all of us. A hospital where you have services, you have even solar panels, is perfect. You have even a very nice view, and this is a hospital in Uganda. Another dream will be this hospital in St. Vincent, and as you can see, it's lovely, and not only with the sun, but green, and with it's attractive. It's a place where you will like to be, and again with solar panels. This is a hospital in Singapore. You see all the plants, all the trees, and doesn't look as hospital. It looks like a nice place, and even if you are not sick, maybe you can have a coffee there. Well, maybe not. But anyway, at least for personnel working there. Another example, this is in Switzerland. Of course, Switzerland cannot be compared with many other places, but look at this. This is beautiful. Trees everywhere, light, natural light, all the services, environmentally friendly. Okay, but this is the reality. This is the reality for many people around the world. And it's not just in this Poste de Santé and in Sansa, but it's the reality for many people, where you don't have the basics. You don't have the capacity to have, look at the way they are dealing with the medical waste on plastic there. Look at the lack of hygienic practices, no water, no sanitation. I mean, it's just a very informal setup, and this is where things has to change. This is a reality as well, and many of the, they want me to look at the camera. Hello, camera? Okay, and now they want me to look at them. Okay, that will be a little bit to combine. Okay, the challenge is over. I have it, thank you very much. Partnership is always extremely important. But I'm Spanish, so I need to use my hands. That was the thing. So the reality for many is that you have, you see, all of those medical waste in the middle of the so-called healthcare facility, no very good conditions. What about water? Maggie, are you there?
Yes, I'm here.
What about water?
Yes, thank you. So I'm really excited to tell you that for the first time we have a global baseline on water sanitation and hygiene in healthcare facilities. Of course, it's not very good news. And I want us maybe just to pause for a few seconds to think about those images we just saw. Because I think it's also, we've gotten used to seeing those images. And if you go to many of these facilities and many of these communities, they've accepted that there won't be toilets, that there will be healthcare waste in the corner, that they're going to give birth on this dirty bed with potentially not having the medicines or the trained healthcare workers they need. but it shouldn't be acceptable. We have 1 in 4 healthcare facilities globally that lack basic water. We have 1 in 5 that have no sanitation at all. And it's not only a problem for the healthcare workers, but it's also a problem for the people seeking care and all the families that come to help in caring for them while they're in these facilities. For hand hygiene and systems for segregating waste, it's about 2 in 5. So these are huge gaps in something so very fundamental and basic. So you can see the cover of the report up there. I encourage you to all go online and look at the data for your country, because there's 125 country data files as well. As I mentioned, healthcare waste is a serious problem. And if we look at least developing countries, so if we look at the situation where resources are the most scarce, we see that only 37% have systems to safely manage waste. So I was happy to hear the regional director talk about we need practical solutions. Well, we have those solutions, and Maria's going to mention them in a minute. Next slide, please. If we look at delivery rooms, now for WASH, we know that the moments around childbirth are some of the most high risk, and it's where for maternal mortality and newborn mortality, we still have some of the highest numbers. And if we had good WASH, if we had energy as well, we would be able to significantly reduce these numbers. If just looking at 6 countries on this graph, we see that only about 50% of delivery rooms in 6 countries had the very basic WASH and infection prevention control supplies they needed to carry out safe deliveries.
Okay, the situation in terms of access to WASH services, water, sanitation, and hygiene is dramatic, but at least I'm sure we have electricity in those healthcare facilities, no?
Sorry, I have to contradict you, because look at that picture. I mean, I'm just like challenging the audience to look at that picture. Can you see anything? It's quite dark. So imagine actually a doctor who has to treat a patient in these circumstances. The doctor would probably not see very much, and yet access to electricity is so important for healthcare facilities to be, reliable, providing reliable services. We need electricity for diagnosis and treatment, but also for powering medical devices. And where do you want to store vaccines or blood if you don't have electricity? So, no, the situation is not very good. Look at this slide, access to electricity across the world. We see that many healthcare facilities yet do not have access to electricity. And actually, if we look at the next slide, it's even more complicated to that. It's not only about access to electricity, but also to reliable electricity. Because if you want to have electricity, it needs to be connected to a grid, which is functioning, and not only functioning for an hour a day. So I'm sorry to say that we are not there yet.
Well, I'm afraid I was a witness of that, and it's not easy and it's not nice to help a woman to deliver with a kerosene lamp. And me, as a very young physician, I've been doing that several times. But this is enough. We don't have electricity, we don't have water. What else can happen to a healthcare facility? Anything else, Elena?
Yes, let me help you to give you a little bit of a frame on what is going to happen with climate change. We already saw and listened from our colleagues the situation in healthcare facilities with regards to access to minimum standards like water and sanitation. The situation is already quite bad worldwide. But then we are already suffering the impacts of climate change. We already seen how the situation is getting in some countries, and we know that things are going to get worse with climate change. We know that the intensity and frequency of extreme weather events is going to increase, and here we can see just 2 pictures. For example, you can see what happened in the Philippines after the Typhoon Haiyan. You see a clear damage on infrastructure, and we are sure that the service delivery was interrupted there. You also see what happens in terms of flooding in India in 2018. It's not only the disruption of the delivery system, it's also what is behind that. You can imagine that there's going to be water contamination even in the facility, and there may be cholera outbreaks and all the health risks that are attached to it. The good thing is that there are already tools available that have been developed by relevant teams. For example, we've listened the regional director to discuss about the smart hospitals that has been developed and implemented successfully in PAHO. We also have the Safe Hospitals initiative, and we have guidance on electricity. More is coming. We are already planning to develop guidance to include climate change within the water and sanitation toolkit that Maggie presented, just to ensure that climate risks are included there. And I leave it to you to continue.
It's not a question of missing tools, guidance. I think this is just an example of how many are we developing, and more that are coming on emergency response and more hospitals and all of that. Tools, guidance, solutions are there. It's a question now of as well as stopping the causes of climate change, not just adapting our healthcare facilities, which is something that we need to do, but looking as well at how to mitigate the causes. But other things happen on a healthcare facility, even radiation. Do we need to do something about that?
Yes, Maria, as you said, there are huge inequities in the access to healthcare services worldwide, but what we can see is that radiation is increasingly being used in healthcare for both diagnosis and treatment, with many huge benefits. But at the same time, the inappropriate and safe handling of radiation sources may result in hazardous risks, not only for patients, but also for health workers and even the public. So there is a need to implement a public health approach to maximize all these benefits, to ensure and enhance the access to these services worldwide, but also at the same time to minimize the risks, particularly for those vulnerable populations like children and pregnant women. We have tools, as Maria said. There are guidance for different safety guides, and one strong tool to use is the International Radiation Safety Standards. This is the basis for developing all the guidance and tools.
And what about the health workers? Do we do something about it?
Thanks, Maria, for mentioning that there are workers in the healthcare facilities, because without workers, they have no function. and if these workers are not safe and not healthy, if they are with infection, or if they are with injuries, with low back pain, or with burnout, the healthcare will be jeopardized. So we have worked together with the ILO to develop tools for work improvement in healthcare facilities. And also we are working with several countries to actually develop national programs for protecting occupational health and safety of health workers, to fill the regulatory gap, because in many countries, unfortunately, the regular occupational health and safety regulations does not cover health facilities. The recent one in Tanzania, for example, the mainland in Zanzibar, developed their national policies. Thank you.
But let's now move on the opportunities. We have plenty of opportunities, and particularly the political opportunities. We cannot miss any of them. One, on Tuesday, we have just launched a health and energy global platform that will contribute enormously to bring clean sources of energy at the healthcare facilities. This is one of the main priorities we will be doing. Then we have another political opportunity in September with the Climate Summit, and you will hear more later on from participants here. We need to respond to this call by the Secretary General to increase the level of ambition to respond to climate change. And according to his own words, health can be the powerful motivation to raise the level of ambition of the country. So we need to make sure that we are there, and of course we will be there. WHO is working with ILO on one of the tracks on this climate summit. But of course we need to look as well for the financial opportunities, for the mechanism to finance the green and climate resilience infrastructure. And please understand me correctly when I talk about the green facilities. I'm not making responsible those in sub-Saharan Africa for contributing to CO2 or not being environmentally friendly. At the contrary, they are not making any footprint because they don't have electricity. But it's more about an efficient, resilient, and environmentally friendly, and making sure for them at least to have access to solar energy and then solving the problem. Another political opportunity, I'm almost done, is about the climate summit, including this health argument, and those are the two proposals that we are making, particularly related to the air quality standards. If we can infiltrate on the climate summit this commitment about endorsing WHO's air quality guidelines, because for us climate change and air pollution are very much overlapping, that will be fantastic, because then we have this major challenge of the 7 million premature deaths. And of course, we have plenty of multilateral environmental agreements that we need to keep pushing, the chemical safety, the water and health protocol, the smart hospital network in the Caribbean, many other examples. And our ideal political opportunity will be to use the healthcare facility as one perfect example of how to integrate all the SDGs. Having access to clean energy, therefore 7, 6, having access to wash, health, water, sanitation, hygiene, and waste management. Of course, respecting all the standards in terms of protection of health workers and climate change and many others. So plenty of opportunities. It's up to us now to take it. Thank you very much.
Thank you very much to Dr. Nera. That really gives us an idea of where we now want to plunge into, and we're going to take that deep dive with our panelists now. We're delighted to be welcomed by the St. Lucia Minister for Health and Wellness, the Honorable Mary Isaac. We still have Dr. Takeshi Kasai, of course, the Honorable Abdullah Amin, the Minister of Health from the Maldives, Josh Kaliner from Healthcare Without Harm, who'll be speaking a bit more about his work there, Romy Tinkopa, the Director for Social Affairs at Peru's Ministry of Foreign Affairs, and also Luke Severi on that side of the desk is the Manager of Energy Access over the UN Foundation in Washington, D.C. Let's jump into it, and I think we'll go to Mary Isaac, the Minister from St. Lucia. Investing in smart hospitals to build health resilience in climate change, vulnerable settings. What do you have to add on that?
Thank you very much, Chair. Members of the head table, distinguished guests, fellow ministers in the room, good morning, or good afternoon, sorry. I'm still on St. Lucian time. It's morning in St. Lucia right now, so sorry about that. Yes, we have started to retrofit some of our wellness centers, and one hospital, one healthcare facility for the elderly. As you know, we are small island states, and these hurricanes, storms, flash floods, and these kinds of catastrophic events have a very serious impact on both our infrastructure as well as our people. We all heard about Hurricane Emma, or Irma, some people say, last year, devastated Dominica and some of the other small island states, also impacted on Puerto Rico, which is, of course, a colony of the United States. And during the passage of this hurricane, it almost took away everything that was standing in Dominica. I believe about 85% of the infrastructure was gone. So that level of devastation is what we experience when we have those disasters, those hurricanes and so on. So we are very prone to strong force hurricanes. I believe that the last one, people could not even determine exactly what force was with the winds and stuff like that. We heard that it was a Category 5 hurricane, but some say it was above that, and therefore there was nothing to actually measure the force of that, the actual force of that hurricane. So imagine when these things happen in these small island states, what you have is almost all your health infrastructure is gone. And of course, you lose sight of your key populations, you lose sight of the people that you have to treat, and it just becomes worse in terms of health care, right? Of course, you have the deprivation of food and housing and everything else, but I think what is most important is that we need our health facilities so that we can provide the necessary services to those people who need it the most. And that is when we do not have these facilities. Therefore, the decision was for us to start looking at how do we build resilience in the healthcare sector. And this is where PAHO, together with DFID, came in and have started to assist us in terms of strengthening our health facilities and building what we call smart facilities for health. So they have embarked on an initiative to retrofit and in some cases build and rebuild about starting with 15 of our healthcare facilities. We have already completed 3 of these facilities, and we are now in the process of retrofitting another 5, and then we will do the balance. Of course, in a small island state like ours, we only have about 35 wellness centers. We have 1 large mental wellness center. We have 3 hospitals, 3 main hospitals, and a smaller hospital. Of course, later on, we are looking at bringing on board 2 new hospitals to replace 2 of the old ones that we have. So going through all of that, we are considering including the retrofitting, making these facilities, these new facilities, making them smart hospitals as we move on, because we really need them so that we can deal with the impact of those strong hurricanes and storms that are impacting on health and wellness in these countries. So our smart hospital facilities, I think that we are looking at one of them right now. They're very small, but compared to our 170,000 population, it serves us, these facilities serve us very well. They are placed in each of the different communities. And I think it is very beautiful. Of course, I do not know what's going on with the grass. Maybe we have not really, taken care of it like St. Vincent. I saw the one in St. Vincent. But this is a very good example of what it is that we have at the end of the day when we go through the retrofitting to create our smart facilities. This is retrofitted with solar power so that we can save on electricity as well as our carbon footprints. We also save on water. We have made it more water efficient. So you use about half the amount of water that you would be using to flush toilets and things like that. And of course, we save on electricity, and that saving, we can then take it and put it back into providing other resources that we need for these very same health facilities. So I think without further ado, I am going to leave the floor to you and see if you have any questions. Please feel free to ask me.
We'll get ready with your questions because we'll get to that point soon. We're going to go now to the minister from the Maldives. So 2 different parts of the world, of course, in 2 different WHO regions, from Amro overway to Sierra, and Abdullah Amin has been in this position as health minister since last year. But interestingly, for many years, you were the minister in the president's office. You really have the political vision of what and how it comes together. This picture is so powerful. We saw it go viral on social media everywhere of that meeting that took place underwater, and it made a very, very strong point that climate change is going to claim those island states. It affects their very survival. Minister, what do you have to add on this in terms of green climate smart hospitals in your countries?
Thank you very much. So I'm not going to talk much about climate change today because I think we have made a very strong case yesterday, and we had talked enough about climate change. I think it's time for action on climate change. Ladies and gentlemen, a very good afternoon. The Maldives delegation would like to acknowledge and appreciate WHO for prioritizing green, sustainable, and climate resilient healthcare facilities agenda. Let me take the opportunity to thank Southeast Asia Region's Regional Director, Dr. Poonam Katrapal Singh, for her leadership to bring all member states of Southeast Asia region together for the Malé Declaration of building health system resilience to climate change. Climate change certainly is a health issue now, more than ever. As you are aware, being a low-lying island nation, the Maldives is particularly vulnerable to flooding and rising sea levels driven by climate change. All health facilities are a few meters away from shoreline, and there are no high points in the country to relocate them. This itself makes the healthcare structure fragile. In addition, increasing extreme weather linked with sea level rise can generate storm surges with flooding that could quickly overwhelm overwhelm island infrastructure and significantly impact healthcare service delivery in emergencies. As first responders, health facilities are particularly vulnerable to the impact of climate change, as they protect the health of their communities during and after these natural disasters. Also, as major consumers of energy and water, hospitals and health centers also contribute to climate change as well. Hospitals and health systems can both build resilient while reducing their own climate impact through a climate-smart approach. Chair, I believe health facilities can play a significant role in reducing pollution, promoting sustainable use of resources, managing waste, and reducing the use of toxic chemicals. By adopting a green, climate-smart approach to providing healthcare, the health sector can build resilience, mitigate its own climate impact, and provide a model for improving community health and well-being. The delegation would like to acknowledge and thank you WHO Maldives Country Office for facilitating feasibility study on use of solar energy in health facilities, hospital vulnerability assessments, and safety index for health facilities, and facilitated Ministry of Health working with Healthcare Without Harm for developing the Maldives Green Climate Smart Hospital policies and strategies, which are currently in the process of being endorsed. With the foundation towards green, sustainable, and climate-resilient healthcare facilities being laid, it's certainly time to focus on implementation. This is where we as middle-income country with limited resources face challenges, and emphasize on the need for continuing technical assistance from WHO and partners, and importantly, financial support from implement sustainable strategies and actions to enable health sector to minimize its contributions to societal impact, build on the green economy, and foster community environmental health. Once again, I would like to reiterate the urgent need to move this agenda forward, and would like to thank WHO for the continuous support. Thank you.
Thank you very much, Minister. And we heard from the Minister from the Maldives and earlier the Minister from St. Lucia talking not just about healthcare facilities, but the impact on human lives, the impact on all of us as a human society. We're delighted that the Director General of the World Health Organization, Dr. Ted Rose Seychelles, is here to join us now. And I know that you've been leaving a very powerful vision. This is why you wanted to make sure that this was right up there with the core parts of the technical briefings. Dr. Tedros, would you care to share a few words with us on this, please?
Thank you. Thank you, James. Sorry, I'm doing hip-hop like a frog from one session to the other. Your Excellency, Minister Mary Isaac, Your Excellency, Minister Abdullah, Excellencies, ladies and gentlemen. Thank you for inviting me to speak, and I'm really glad I could be here, even if it's only for a short time. As you know, healthcare facilities are the operational heart of service delivery, protecting health, treating patients, and saving lives. Yet, health facilities are also a source of carbon emission, contributing to climate change. Across the world, health facilities churn out carbon dioxide through the use of significant resources and energy-hungry equipment. This is perhaps ironic, given that, as medical professionals, our commitment is to first do no harm. Places of healing should be leading the way, not contributing to the burden of disease. The world needs health facilities that contribute, that demonstrate that increasing climate resilience and mitigating carbon emissions can be complementary rather than competing objectives. There is so much that can be done. Facilities can transition to renewable energy, employ energy efficiency measures, install solar panels, use rainwater tanks, implement sustainable healthcare waste management, and refuse single-use plastics. Unfortunately, most healthcare facilities in low and middle-income countries lack access to reliable energy supplies. For example, 1 in 4 health facilities in sub-Saharan Africa lacks access to electricity, and many more have intermittent, unreliable supplies. The health sector needs to work closely with the energy sector to transition to clean energy. I'm proud that this week, together with UNDP and UNDESA, we launched the Health and Energy Platform of Action. This platform will strengthen the political and technical cooperation between the health and energy sectors to accelerate the transition to clean energy. The initial focus will be on clean cooking and healthcare facilities. At this meeting, we have representatives of Spain and Peru. You will hear how these countries are working to promote health as a political driver for increased ambition on climate change. The Secretary General's Climate Summit this year will be an important opportunity to secure strong commitments to investments in proven interventions for climate-resilient health systems and in air quality monitoring and policy implementation. As always, WHO stands ready to support all countries to take action towards a fairer, safer, and healthier world. I thank you. Thank you for this opportunity.
I think the opportunity here of having the world's health chief in this room is, what would you say to him? What would you say to him in 60 seconds or less? I'll take any comment from in this room, a comment, an idea, or a question. Please.
Thank you. Thank you. Dan Jones from WaterAid. On Wednesday, Dr. Tedros, you said, health facilities must be places of healing, not harm. And if we're not doing the basics, who will trust us with all the other things? I think, as Maria and Maggie highlighted earlier, the challenge of the lack of water, sanitation, and hygiene in healthcare facilities is huge, and there should be no excuse for it in 2019. The climate crisis is increasing the frequency and the intensity of droughts, extreme rainfall, and severe cyclones, modifying the transmission of foodborne, waterborne, and infectious diseases. And all of this is impacting on water, sanitation, and hygiene in healthcare facilities. So I would encourage Dr. Tedros and member states here to act urgently on that.
Okay, so we start off with WaterAid. Just very quick interventions. We've got the delegate at the front over here as well. And anybody else, just raise your hand so I know.
Fika Nasser, Professor of Public Health from Egypt, and representing Medical Women International Association in the meeting. I really would like to pay tribute to two people, Dr. Mehler and Dr. Tolba. Dr. Mehler was the director for WHO, Dr. Tolba was the director for UNEP. And in this room, in 85 or 86, I can't remember, we've been putting together the outline that we cannot afford to wait any longer before we do changes, otherwise the changes will be disastrous for the world, the carbon dioxide, etc. So I thought to bring to the audience that the talk has started many, many years ago. This was 35 years or 33 years ago. And now is the time that we have action. And this action, as you said, should start within the health facility, but should be in the minds of all those who are dealing with health. Thank you.
Thank you. We've got the minister from Seychelles, and then we're going to move to the two delegates, one in front of the other.
Thank you very much, and thank you very much also, Dr. Tedros, for being with us. I think in the context of small island developing states, we really appreciate we've got the new action plan for small island developing states, in particular to address climate change. And I think it's really about a question of how we can support particular smaller countries with the right model in terms of the basic facilities that we provide, keeping in mind as well, if we take the example of Seychelles, a huge expanse of ocean with isolated islands. I know that's often the case in the Pacific as well. And how you can basically have the right framework that allows you to deliver that care despite those challenges. Then I think a few other key issues that we should flag is the case for solar panels, for example, or other renewable energy. It's not a case of islands contributing to global warming, but it's a question of efficiency. In Seychelles, we've actually started a project partly funded by the government of India, where we are already saving from the panels that we've put in place about $100,000 a year, which is not much, but that's $100,000 that can go directly into programs. So I think that the idea is to really mainstream climate change preparedness, and that includes in terms of addressing vector controls, for example, in our health systems. And the final thing that I'll just mention is that we're also doing a project to actually train our health workers to factor that in the long term. And I think we look forward to support from WHO on that in line with the SIDS action plan.
Thank you to the Minister from Seychelles. So we're going to go to the center two, first in blue and then the delegate behind you. Then we're going to move to this side of the room. If there are any others I'm missing from that, please. Yes, there we go. So we'll go here first, please.
Thank you very much, and I'm very appreciative for WHO for taking up this very important issue. We need to have good healthcare centers or healthcare settings just to because what we anticipate as climate change, and we need to have good healthcare settings. So it is about the environment of the healthcare settings, and you have the patients and the others, and also the healthcare workers. So with climate change effects, of course, we know that emerging, re-emerging diseases, and also even natural disasters, so all those can harm the healthcare settings. So we need to look at these things in a comprehensive way and then give simple solutions to strengthen the healthcare settings in terms of climate change. So I'm very much appreciative of the fact that the Director General mentioned that there are so many people, like the healthcare settings, they care for the sick. So healthcare staff, we have to care for the carers. So it's not only the healthcare, like the greening part. Yes, that's very much, we have to do that. But in addition to that, we need to look at the healthcare workers, the health of healthcare workers. And in fact, Sri Lanka, we have started like developing a program to care for the healthcare staff, occupational health and safety and well-being, in order to address the occupational and work environment risk. So I suppose we need the support, and we very welcome this approach, and then we really support this initiative. Thank you.
Sorry, I hadn't seen your nameplate from this distance, but it's thank you to the delegation from Sri Lanka. We'll move behind you, please.
Thank you very much, Chair. Anja Lietz from the German Alliance for Climate Change and Health, and we are working with our doctors and nurses to educate the public and speak up about the challenges. So the healthcare sector can be part of the solution, and it's really important that we have that conversation in the public. Thanks.
Thank you to the German Alliance. We move to these two delegates here, starting with you, please.
Hello, I'm Sushila from Nepal, and I'm representing International Council of Nurses, and I'm studying disaster nursing. I'm a PhD student. So we talked about the lack of wash, lack of electricities, and green hospitals and all. Since I'm a disaster nurse, Nepal is a developing country, we know all. We have minimum healthcare facilities. At that time, we saw a lot of challenges. One challenge was the proper place for the dead bodies, mortuary. I had my friend, she lost her mother. People were crying, I can feel the pain. And what I want to say here is, we talked about the health, not only like, breathing is not only the health, we should think about the respect for the dead bodies as well. So I'm just, for now, only pointing out that point for these sessions. So we should also think about the respect for our human body. That's all. Thank you.
Yeah, dignitaries in the dais. I'm also from Nepal, by coincidence. I think I'm working in an Alternative Energy Promotion Center, the head of that body in Nepal. I think one of the points I want to bring the discussion is the solutions we are talking, the engineering solution for energies. The quality assurance and sizing of that also is very important. Besides all this benefit we have been discussing on this new renewable energy, solar panel deployments, things come in place. Basically, the health facilities are under the Ministry of Health. And these facilities are mostly, we are providing the engineering solution to the off-grid areas where there is no mainstream grid lines. And then quality assurance of these is very challenging. Most of the things are done by NGOs, INGOs in these areas, not properly coordinated with the energy experts. And then maintenance of these systems is a real challenge. One-time deployment looks very nice, but as an energy student, I see most of these solutions, they are not sustainable in terms of their serving their lifetime energy needs. So I think the more coordinated efforts in designing the engineering solutions and maintaining them in the longer term needs to be thought through to make them more sustainable, because these two ministries needs to be coordinated properly, energy solutions and then the hospital management systems. That's one thing, and we also had a lot of these disaster-related health issues where the portable energy solutions like solar panel or other things will be very important. So I think the part of the preparedness should include the plug-and-play type of energy solutions where we can quickly move these to the disaster-prone areas and provide services to people. So I'm just a little bit highlighting on the engineering aspect of the green energy solution deployed to make it more sustainable. Thank you.
I know I have one more on this side of the room, but before we go to the delegate, is there anybody else who wants to speak directly to Dr. Tedros here? If you do, on this subject, this is your opportunity. If not, I'm going to go to this delegate first.
Good afternoon, everyone. My name is Tariq Zin. I'm a representative of the International Federation of Medical Students Associations. I just wanted to mention that we should all, as healthcare professionals, lead by example and do what we would like to see in this world. Usually it's young people following grown-ups and following their examples, but we, as the International Federation of Medical Students, we try to be as environmentally friendly as possible. In that sense, we build capacities among our members toward the importance of climate change and health. And we started this global campaign to include climate change in all medical curriculum by 2020. Last but not least, we published this recommendation for sustainable and climate-friendly meetings because we would like our meetings themselves to be sustainable and it's small things. It's the badges that we print, it's the mug that we bring to drink the water in, and we would like to see this kind of behavior happening in all meetings across the world. So this is our way to say that we believe we should be socially accountable future physicians that care about the health of people, not only in the hospital, but people when they're facing the environment, when they're living their normal life. We should not wait for them to get sick and get to the hospital. We should make sure that we care about their health more holistically. Thank you very much.
You were holding up your reusable drinking flasks. Thank you for the contribution. Exactly, walk the talk. That's what Dr. Tedros always says, and over there as well. I think we're going to finish off with one more intervention here before we return to the panel.
Hi, excuse me, thank you. My name is Eleanor Blomstrom from the International Women's Health Coalition. And I just wanted to talk a little bit about the important intersection between gender equality and climate change and women's leadership, as well as women's health and sexual and reproductive health and rights, and how they all really come together in the way a healthcare facility is designed and operated We know that women are on the front lines of climate change and are impacted in different ways and often more severely by the climate change impacts. At the same time, they're often those who are caring for others who are sick and ill as a result of changing disease vectors, et cetera. And so it's really important as we're looking at ways to address healthcare facilities and improve them, that we're really thinking about what women need, what girls need, what marginalized peoples need in those spaces. Thanks.
Thank you. Let's go now back to our panel. We've still got Josh Kalina, we've got Romy Tinkopa, and we've got Luke Severi. So I think we will, we'll go to the Director for Social Affairs at Peru's Ministry of Foreign Affairs, Romy Tinkopa. Obviously, and I think we've heard this time and time again today, that there is a major political opportunity for health in the upcoming major UN gatherings. And Ms. Tinkopa, can you give us an update on what's happening in Peru's initiative to raise health as the political driver at the SG's climate summit to come?
Thank you. Good afternoon to everyone. Thank you very much for this opportunity to share with you the commitments of the Social and Political Driver Coalition in preparation for the upcoming Climate Action Summit convened by the Secretary General of the United Nations that will take place in New York City on the 23rd of September 2019. Now let me to continue in Spanish. Okay. Quisiera compartir con ustedes ¿qué es la coalición sobre desafíos sociales y políticos? Esta coalición está liderada por el Perú y por España con el apoyo de organizaciones internacionales como la OMS, la OIT, el DESA, que es la Dirección para Asuntos Económicos y Sociales de las Naciones Unidas, por el Naciones Unidas Global Compact, y por el equipo de negocios conocido por el B-Team. También apoyan esta coalición países como Polonia, Nauru y Grecia por el momento. El objetivo principal de la coalición es garantizar que los aspectos económicos, ambientales y sociales de la transformación hacia economías verdes y sostenibles se gestionen de manera que maximicen las oportunidades de trabajo decente para todos, reduzcan las desigualdades, promuevan la justicia social y aumenten los esfuerzos de los países para mejorar la salud de las personas. Para lograr esta coalición hemos identificado dos grandes temas. Un tema relacionado a la transición ecológica y a la creación de empleos verdes, y el otro tema que está relacionado a la salud y al cambio climático. En esta oportunidad nos vamos a explayar sobre el segundo tema, que es la salud y el cambio climático. La coalición ha propuesto dos principales compromisos en salud que cubren muchos de los desafíos y preocupaciones relacionados con la salud y el cambio climático. Uno de los compromisos está relacionado con el aire limpio y el otro está dirigido a las instituciones financieras, orientado a ampliar las inversiones en la salud. El primer compromiso se dirige a los gobiernos, tanto nacionales como subnacionales, para que se comprometan a alcanzar estándares de calidad del aire seguros para sus poblaciones y alinear sus políticas de cambio climático y contaminación del aire al 2030. Los gobiernos nacionales y subnacionales que se obliguen políticamente en el citado compromiso deberán adoptar las siguientes medidas específicas. You have it there? No. Okay. Primero, esto es lo que ha propuesto la coalición para que los países puedan implementar estas acciones en favor de sus poblaciones. Implementar políticas de calidad del aire y de cambio climático que logren los valores de la Guía de Calidad de Aire de la OMS. Implementar políticas y acciones de movilidad eléctrica y movilidad sostenible
con el objetivo de lograr impactos decisivos en las emisiones del transporte vial, evaluar la cantidad de vidas que se salvan, las mejoras en la salud de los niños y otros grupos vulnerables y los costos financieros evitados para los sistemas de salud que resultan de la implementación de tales políticas. El seguimiento del progreso, el intercambio de experiencias y las mejores prácticas a través de una red internacional respaldada por el sistema de las Naciones Unidas. Como ustedes saben, los gobiernos son los principales responsables de la salud de su población y estas acciones que la coalición está dando están dirigidas a salvar vidas, que es lo más importante, ¿no? La evidencia muestra que cumplir con el Acuerdo de París ahorraría más de 1 millón de vidas al año para el 2050, a través de la reducción de la contaminación del aire y que el valor de las ganancias para la salud sería aproximadamente el doble del costo de la mitigación. El segundo compromiso está dirigido a los bancos multilaterales y de desarrollo, a los fondos destinados al cambio climático, a las agencias bilaterales de cooperación y a sectores del sector privado, los cuales se deberán comprometer a incrementar significativamente sus inversiones en intervenciones comprobadas en apoyo a sistemas de salud climáticamente resilientes, así como en el monitoreo de la calidad del aire y en la implementación de políticas. Entonces, ¿en qué se debería invertir? Se debería invertir en sistemas de respuesta y vigilancias de salud basadas en el clima para, por ejemplo, olas de calor, tormentas, inundaciones, enfermedades transmitidas por el agua, así como el cólera, la malaria, el dengue. Inversiones en instalaciones de salud climáticamente inteligentes, usando la energía renovable y minimizando las emisiones de carbono. Inversiones en desarrollo de políticas de calidad del aire y mitigación del cambio climático en países en desarrollo. Inversiones en desarrollo e implementación de planes nacionales de adaptación para la salud, tomando en cuenta sistemas de alerta temprano, preparación y respuestas a emergencias de salud asociadas al cambio climático. Este objetivo es proteger también la vida de las poblaciones más vulnerables y contribuir a cumplir y ampliar los compromisos de París en materia de financiamiento para la adaptación, abordando la brecha ampliamente reconocida en el financiamiento de la adaptación a la salud, incorporando el cambio climático en sus inversiones centrales. Finally, building a healthy world for all means joint efforts. In this regard, the upcoming high-level meeting on universal health coverage and its political declaration will contribute to implement the main objective to the coalition, improving people's health, and to increase global awareness, international cooperation, and investment on health and climate change. The leaders of the coalition encourage you to support this initiative towards a healthy planet for a healthy people, making sure that no one is leaving behind. Thank you. Gracias.
Thank you very much to Peru, and we're delighted to be joined now by Dr. Naoko Yamamoto, who is the Assistant Director General here. I'm sure she'll share a few words with us a bit later, but we're going to catch up to speed first with what's going on over here. ADG, we had a couple of ministers, as you know, as you were briefed already, and Peru and Maldives, and also with St. Lucia. So we are going to go now to the voice, I think. This is an appropriate time to go to the voice of the people, to civil society. Josh Carliner joins us from San Francisco in California, where he is the International Director of Program and Strategy at Healthcare Without Harm. He has coordinated his global work for the last 14 years, and in this capacity, he's been responsible for creating and then developing Global Green and Healthy Hospitals Network. Josh, I know that you have a couple of slides to share with us. So talk us through them and annotate it as a story. We're going to start off with the paradox up on the screen.
Thank you very much. Honorable ministers, distinguished guests, it's a pleasure to be here, and I want to thank Maria Nader and her team for inviting me today to speak with you.
Josh, give me 1 second.
How's that? Is that better? Okay. This is one slide too fast. Okay, my organization is called Healthcare Without Harm. We're a 20-year-old NGO. We work around the world with WHO, UNDP, UN Environment, Ministries of Health, hospitals and health systems to transform the healthcare sector worldwide so it reduces its environmental footprint and mobilizes its ethical, economic, and political influence to create an ecologically sustainable and equitable and healthy world. We're here today, and my organization is founded on the paradox, on addressing the paradox that health systems contribute to a series of environmental health problems. By trying to cure disease, we are also inadvertently contributing to disease. And while Maria ran through some of those problems, I'm going to, before I get to some of the solutions, do a quick overview here of what some of those problems are. So healthcare waste, medical waste, which is pathogenic waste, sharps waste. It's waste that comes from hospitals and health facilities in terms of plastic waste, anatomical waste. All of that, the management of that waste is significantly lacking in every region of the world. And over half the world's population is exposed to its negative impacts. Healthcare also has a significant chemical footprint. The continued use of mercury-based medical devices in many facilities, the deployment of carcinogenic, mutagenic, and endocrine-disrupting chemicals in healthcare operations and buildings all contribute to chemical pollution that contributes to the burden of disease. And of course, the big one, climate change. Climate change, as we know, is one of the greatest health threats of this century, and our health systems, first of all, as was mentioned earlier and has been mentioned throughout this panel, are not prepared to deal with it. Our systems are not resilient. They are being impacted in low-income countries, in middle-income countries, and in high-income countries. The pictures you see on the screen, one is from India, the other is from San Francisco, California in the past year. There could be dozens more pictures from around the world of how health systems have been impacted by extreme climate-related weather events. At the same time, as has been mentioned, healthcare's global carbon footprint is significant. In my country, in the United States, which is the biggest historical emitter of greenhouse gases and the second largest emitter of greenhouse gases today, it's 10%. Around the world, in an estimate that we did with the World Bank, we found that it's about 5% of global emissions. That is not insignificant. So healthcare is contributing to the climate crisis, which is the greatest health threat of the 21st century, according to the Lancet. Where do those emissions come from? They come from energy use, for heating, for cooling, and for powering health centers. They come from waste anesthetic gases. They come from transportation fleets, and they come from particularly the supply chain of healthcare. And of course, we live in a very unequal world. And so the responsibility for those emissions rests primarily with the wealthiest countries, but also as healthcare rapidly develops in middle-income countries, the emissions from those hospitals are contributing to climate change as well. While in low-income countries, particularly in areas without access to electricity, the problem is different. It's the need for sustainable low-carbon solutions to power health. But there's a framework that I'm going to get to that addresses all of this in one package. But really, here's what we've got to do, is we've got to overcome this vicious circle where healthcare is contributing to the pollution that is generating more and more patients, increasing healthcare costs, and lowering the health of the general population. Luckily, the world has developed, and the world's governments have developed a series of frameworks to address this problem. There are a series of multilateral environmental agreements that we can align global health goals with. There's the Montreal Protocol on the ozone layer. There's the Stockholm Convention on persistent organic pollutants. There's the Minamata Convention on mercury. There's the Convention on biological diversity, the Rotterdam Convention, the Basel Convention on the transboundary transport of hazardous wastes, the Framework Convention on climate change, and the Strategic Approach to International Chemicals Management. All of those, except the last one, are binding international agreements that the world's governments have adhered to, and healthcare is not and should not be exempt from complying with these agreements. Most importantly, at this moment where we know we have less than 12 years to turn the ship around and address climate change, we need to align the healthcare sector with the Paris Agreement's ambition of reducing emissions so that we don't surpass the 1.5 degree threshold that will lead us to greater and more catastrophic climate change. The good news is, by doing that, we can also help power health with green, climate-smart solutions that promote equity and universal health coverage. This is a win-win scenario. And of course, it will help us contribute to many of the Sustainable Development Goals. So, try to put it succinctly, the 21st century health system, that dream that Maria was talking about, needs to become a reality all around the world. It is required, it is absolutely necessary that the 21st century health system be green, that it be sustainable, and that it be climate smart. So what is a green health system? We've been talking about it all day, and it's actually kind of hard to define. Back in 2011, my organization tried to create a definition, and I want to read it out to you here because I think it's important that we all start to get on the same page on what a green health system might be. A green health system promotes public health by continuously reducing its environmental impact and ultimately eliminating its contribution to the burden of disease. A green health system recognizes the connection between human health and the environment and demonstrates that understanding through its governance, strategy, and operations. A green health system connects local needs with environmental action and practices primary prevention by actively engaging in efforts to foster community environmental health, health equity, and a green economy. So that's the definition that we came up with, and then we created a 10-goal framework to begin to try to implement green health systems around the world. And so these 10 goals are leadership, chemicals, waste, energy, water, transportation, food, pharmaceuticals, buildings, and purchasing. And based on that framework, in 2011, we launched a worldwide network, Global Green and Healthy Hospitals, and it caught fire. Today, there are more than 1,100 institutional members of Global Green and Healthy Hospitals in 58 countries. These members represent the interests of more than 36,000 hospitals and health centers on every continent. They are private systems, they are public systems. All 180 public hospitals in Chile, for instance, are members. And I'm really pleased to announce that the Ministry of Health of the Maldives became our first national health ministry to join Global Green and Healthy Hospitals. So Global Green and Healthy Hospitals has a series of tools and resources for hospitals and health systems to actually implement green healthcare strategies in the goal areas that I mentioned. But what I want to talk about for the rest of my time here is so 4 examples of greening health facilities, 4 big picture examples here. The first is, as many of you know, the Western god Mercury is the messenger god, and in many ways, Mercury has been the messenger on green hospitals around the world. We've been working, and we've worked with WHO for more than a decade to substitute mercury-based medical devices with accurate, affordable alternatives, country by country, in this initiative called Mercury-Free Healthcare, which now no longer exists because there was a global treaty that the world signed called the Minamata Convention in 2013 that mandates the phase-out of mercury-based medical devices by 2020 and the phase-down of mercury dental amalgam. So this is an example of a successful initiative for green healthcare and green hospitals in one specific area. Second example is we're seeing increasing uptake around sustainable healthcare waste management. It's being integrated into WASH, and so WASH in health facilities is focusing on sustainable healthcare waste management, and there are a series of different projects around the world that are demonstrating alternatives to healthcare waste incineration through the use of autoclaves. This one is a project that WHO, UNDP, and Healthcare Without Harm are doing under the Global Environment Facility in 4 African countries, in Zambia, Madagascar, Tanzania, and Ghana, demonstrating how we can actually manage healthcare waste in a way that addresses the problems that we were talking about earlier. And of course, we're also beginning to work on plastics in healthcare waste. A recent study that we did in the Philippines and Indonesia found that between 50 and 70% of all healthcare waste is plastic waste. And so we were talking yesterday about how so much of that plastic waste ends up in the oceans. Healthcare has a responsibility to address that, particularly in the non-medical uses of plastic in our cafeterias and in packaging and many other areas. The third initiative is around greening the supply chain. And this can happen in a lot of different ways. We are, the UN is doing something called the Sustainable Procurement in Health, SPHS, which is trying to green the UN's health supply chain, which is about $5 billion of purchasing a year. We're also working with UNDP on a 10 low-income and middle-income project to develop criteria for sustainable procurement in healthcare that can be then scaled around the world. And this is around chemicals, it's around resources, and it's around carbon. So think about this for a second. Healthcare in many countries serves meals. A lot of those meals have meat in them. A lot of that meat is bred, the animals are bred with antibiotics. If there's criteria around purchasing antibiotic-free meat, healthcare can actually begin to turn things around AMR and address animal agriculture and the use of antibiotics in animal agriculture. Healthcare can purchase low-carbon solutions and energy-efficient medical devices and reduce its carbon footprint. Okay, so for the last piece here, climate-smart healthcare, and this is perhaps, again, the most important one. We have developed together with the World Bank this framework of climate-smart healthcare that doesn't distinguish between adaptation, resilience, and mitigation, but rather it brings it together into one framework. So we can work for resilient healthcare facilities at the same time that we work for low-carbon healthcare facilities, and we can mobilize healthcare's leadership to be climate-smart and to advocate for policies that address the root causes of climate change. We're doing this in a number of different ways. There's something called the Healthcare Climate Challenge, which about half of our network is part of now. So more than 180 participating institutions representing 17,000 hospitals have committed to this framework of mitigation, resilience, and leadership, are reducing their carbon footprint, are measuring it, and are reporting out on it. And you can find all of this on our website if you're interested. Many of these institutions are committing to 100% renewable electricity. So we have big institutions like Kaiser Permanente and the Cleveland Clinic that are going carbon neutral in the United States. You have the same thing in Europe. We have a hospital in this picture in Morocco that's committed to 100% renewable electricity. And as we'll hear from Luke in a couple minutes, there are many off-grid health centers that are moving toward 100% renewable in order to power health. Finally, in order for us to actually have green, climate-resilient, sustainable healthcare, policy action is necessary. Healthcare needs to be put into climate policy, and climate needs to be put into health policy. In other words, there needs to be health in all policies and climate in all policies at the subnational, national, and global levels. Fortunately, there are a series of examples of how this is happening already. The NHS in England has a national carbon reduction strategy. You see here the cover to a national strategy on climate health and well-being for Australia that's been endorsed by the Labour Party of Australia, and while they almost won the election, and this would have become their national policy, it is happening at many subnational levels in Australia, so several states are taking this up. As the minister from the Maldives mentioned, they have developed a strategy that they're about to endorse together with the World Health Organization and Healthcare Without Harm for green climate smart hospitals. And this other cover you see is a resilience strategy developed by the National Institute for Environmental Health Sciences, NIEHS, which is part of Health and Human Services in the United States for climate resilience in healthcare in the US. This was a few years ago. We also are not able to implement very many national climate policies in the United States right now, unfortunately, but at the state level, it's happening as well. Okay, so we need to bring this to scale, and then I'm almost done here. In order to act, so these are a series of examples, right? But for the sector to move, for the entire health sector to align with Paris, we need to bring this to scale. And so what that means is we need a global roadmap for climate smart, decarbonized, resilient healthcare that aligns with the Paris goals. We need to establish a methodology for national and subnational governments to measure and track their carbon footprints. And we need to support the development of national and subnational action plans to achieve these goals. And the good news is that Healthcare Without Harm and WHO are talking about how to do this, and hopefully by next year we can come back to you here and report on a real plan to move this work forward. But I would encourage everybody from Ministries of Health here to start thinking about how you can begin to implement these climate-smart health policies in your countries. And I would encourage everybody from bilateral and multilateral lending institutions to also consider how we can move the $37 billion a year in health development assistance to climate-smart strategies. So, last slide. You all are the messengers. You all are the leaders. As Maria showed yesterday, doctors and nurses are the most credible messengers in most countries in the world. Healthcare, as Christiana Figueres said 2 years ago at the World Health Assembly, as healthcare, we need to take the health megaphone and articulate both the health impacts of climate change and what the solutions are. And the basic message from our perspective needs to be fossil fuels, which are the primary driver of climate change and air pollution. Fossil fuels kill, clean energy saves lives. Thank you very much.
Thank you, Josh, for your very enthusiastic contribution. Let's go to Luc Severi, who's the Manager of Energy Access at the UN Foundation. Luc oversees the picture or nexus issues, in particular on energy gaps in the healthcare sector, but also linking that to the humanitarian sector. And of course, we all know what the great work that the UN Foundation does every day for people everywhere. He also manages its day-to-day activities on its Powering Healthcare initiative, and he's part of this global plan of action for sustainable energy solutions in situations of displacement. I think it's important also in this context, Luc, to mention that you've worked in many parts of the world, Mozambique, Senegal, Liberia as well. So you bring insights from all those experiences.
Thank you, James, and thank you, everyone. I have 5 key points that I want to drive home, and I only have a limited amount of time, so I'm gonna try to be very concise. And some of these things have already been said, especially by the DG, by Josh as well. Energy in health facilities is critical. It's critical to achieve universal health coverage. I hope I don't need to convince anyone in the room how important energy, how important electricity is for WASH, for vaccination targets and chilling vaccines, also for the health facility staff to actually keep them there, to make them comfortable, especially when we look at primary healthcare facilities in very rural areas, very difficult areas that are not connected to a national grid. Because you don't know how dark is until you've spent the night in the village, and I hope that some of you have, and that all of you will. Today, that means that still roughly about 3 in 4 health facilities in sub-Saharan Africa lack reliable power. The DG already said 1 in 4 just have no power altogether. They have no emissions that we need to avoid. They have no power. That means that many vaccines, of course, are actually spoiled because of an interrupted cold chain. The working conditions for the staff are extremely difficult. They're not able to actually carry out the services that they want to. It limits them immensely in terms of actually delivering health services at the primary healthcare level, which in the developing countries is where the majority of the people, women, children, depend on for their access to health services. The positive part of the story is we actually have the technology already. We know how to do this. We have innovative clean energy solutions that can provide in a cost-effective way, in a clean way, and actually in a pretty fast way, power to remote health facilities, to rural primary healthcare facilities. We're looking primarily at solar energy solutions when we look at sub-Saharan Africa, but it could equally include hydropower, wind power. There's a whole range of solutions that are out there that can actually provide the energy services that are so desperately needed at the health facility and in the health sector. And there's a very vibrant energy access sector that's waiting to jump on this opportunity, that's already been deploying at a very large scale these exact type of solutions to households in these rural areas. And yet we're still in the situation with 1 in 4, which is the same number that we see in WASH actually, not coincidentally, of health facilities that just lack power altogether. the business as usual is not addressing this. I said this yesterday as well, we actually find a graveyard of solar panels on the rooftops of these clinics. It's not that we're inventing something new, we just haven't figured out how to do it well. We all want to do good, we need to figure out how to do it well. So to unlock this immense potential that exists between this energy and the health sector, we need to make it more of a priority, and we need to empower ministers of health, and we need to empower ministers of energy, and we need to inform and empower ministries of finance to actually make this a priority whenever annual budgeting processes take place. We need to find sustainable delivery models. I'm steering away from business models. I'm talking about delivery models that clearly have a strong element of collaboration, of coordination between the energy sector and the health sector. And it will automatically involve smart partnerships. We need to be innovative here. We need to figure out what role does the public sector play as the managers of these health facilities? What part does the private sector play? What part does civil society play? And all of them have a role to play at the international level, the national level, the regional, the district, up until the village, both in between the health and the energy community. And that means that it's quite difficult. We need to coordinate, we need to collaborate, we need to provide these platforms for the doctor to talk to the engineer, because they speak different languages. So you want to have that platform to actually make sure that that conversation happens. Similarly on financing, we need to have a good discussion on health systems financing, and we need to tap into climate financing and find that bridge and figure out where do those two dock and how can we make sure that the money actually starts to flow once we have proven technology, proven delivery models, because that is the way to actually enable universal health coverage and to actually create a resilient health sector. So lastly, my last big point is powering healthcare. It's the initiative that the UN Foundation is currently running in collaboration with many partners, with SE4All, with the UNDP, with WHO, Gavi. Many of you are in the room today as well. And this is an issue that nobody should be tackling alone. All of you in the room have a role to play. About a month ago, we convened the energy access, so the off-grid energy community with the health community at a multi-day conference in Nairobi, and Maria was there. It's so important for the two communities to keep on meeting and to make sure that that conversation flows, because that's the only way that we are going to be able to address this intersectoral problem in an intersectoral way. And the main takeaways from that conference that we organized was we need more data. We actually, 1 in 4, it's an estimate. We actually don't know. We don't know how many health facilities lack power. We don't know how many are under-electrified, which means maybe they have a little bit of power, but not enough. How many are unreliably electrified? We want the global baseline that the WASH people have. So, Maria, I'm looking at you. We're working on this later this year all together. We need more information on financing sustainability. How do we do this? How do we step away from a very heavy procurement model to a more service model that is more sustainable? Putting a solar panel on a roof is easy. Keeping it working for 20 years, that's the hard part. Having that long-term horizon. Thirdly, the energy-efficient medical appliances. We actually haven't really spoken about them much, but they play a massive role in driving down the energy needs of the health facility while also enabling health services, even at that primary healthcare level. And then lastly, the need for coordination between health and energy. I can't stress this enough, how important it is. And in Nairobi, Maria was there and basically baptized all the energy people into health practitioners. And Josh just did the same for all the health people here. We're all now climate advocates. We need to do this together. And the last thing I want to say is the conversation clearly doesn't end now. We keep on talking about this. There are many, many moments on the agenda this year still. The SDGs Climate Summit is definitely one. But even later today, we are continuing this conversation with our colleagues from the Ministry of Health in Uganda, with the Ministry of Energy here from the AEPC in Nepal. Later today in an official side event at 7 p.m. It's in room 9. Maria will be there as well. And I can't really think of a better way to spend my Friday evening in Geneva. What about you, James?
I don't know. I wasn't invited, Luke.
Oh, you are now.
No, I'm invited. Thank you.
Yeah.
Thank you very much, Luc Severin. I think that you really injected a lot of the emotion that we need in this as well, because I think sometimes, not emotion for emotion's sake, but emotion, as a sense of urgency. By the way, Dr. Tedros, before he left, he told me that he very much enjoyed what you had to say. I believe you're a student. Sorry, I don't know your name. Tariq was talking about. Tariq, which organization are you from, or where are you studying?
In Tunisia, and I'm from the International Federation of Medical Students Associations. My name is Tariq.
Okay, so Tariq was talking about walking the talk, and also the minister from the Maldives said that in his own words as well. And when we were talking, referencing your picture on climate change, you said, well, I'm not going to talk about climate change anymore because the talking is done. And now is the time for action. So Dr. Tedros said, what did he say? He said, it really is about walking the talk. I still think of walk the talk on Sunday as that physical activity that we did, but I think he meant it so much more deeply. All of you did in the leadership as well. And he said, you start, he took what you said over there, you start with whatever you have. You don't need to wait for that perfect set of conditions. I think you mentioned that as well. You start with what you have, whether it be the reusable containers or whatever it is that you're referencing over there, and then you take it away from that. But I think, Luc, you raised a number of very important points over here. We do have a little bit of time together, so I'm trying to think what's the best way to use it. First of all, I want to say, does anybody else want to say anything from this inclusive conversation over here? You do? One gentleman here. Anybody else? And another one there. We'll go to those two first, please.
Thank you so much. I'm Ciro Ugarte. I'm the Director of Health Emergencies of the Pan American Health Organization, Regional Office of WHO for the Americas. We've seen the Smart Hospitals initiative ongoing in the Caribbean for 7 years already. A couple of years ago, there was a Hurricane 5 that affected many islands. The Virgin Islands was affected severely. One of the very few infrastructures that withstand the Category 5 hurricane was the hospital. And the hospital hosted the National Emergency Management Office, the police, the firefighters, but also provided water to the surrounding community and some energy also to charge cells. So in the Caribbean, it is not a dream. It is a reality. It is happening. And in many hospitals. So we don't have to wait for that. But it's coming because there is a lot of commitment of the governments, of the communities, through town halls, on the private sector, because the private sector is learning how to do energy, how to do water, how to do all the things, but also because the Caribbean, and also in the Americas, the countries in the Americas, the ministers of health actually agreed in 2004 that we will not put the health facilities at the center as they decided in '85 after the earthquake in Mexico. They are putting the people at the center. So everything that we do in the health services is for the people. So when we put the people at the center, it is how we're gonna stay operational and also how we're gonna reduce the carbon footprint for the people, not for us. Because we were talking about vulnerability reduction in health facilities for 20 years, 85 to 2005. Just to let you know that this is something, and the new global standard on hospital and health facilities resiliency is here.
We've got one more comment there. We've got one more comment over there, and I think that Maria, because you've helped design, you've designed the session, and because you've been leading this for so many years, it would be great if you could start responding to some of the thoughts and connecting some of them as well, the points that have stood out. I know you can do it very, very well. So the lady over there, and then Maria will take it, and then Nalka will close after that.
I'm Vishnupriya. I'm from Kerala, India. I am a representative of the Network Towards Unity for Health. So the picture regarding the flood in Kerala in 2018 was displayed on the slide. So it was a situation where the heavy rainfall and the opening of the dams, it led to a devastating flood which struck our state in August 2018. It was basically a midnight emergency. The water level had risen at an alarming level. Even the National Disaster Response Force and the security forces, they were even in a dilemma as to how to begin the rescue operations, because in many areas, even airlifting, it was not even available and it was not even feasible. So it was a fisherman community from Kerala who led the rescue mission, who came for this with their fishing boats, and even for the rescue of people from the remote areas. So in this platform, what I would like to present is to the international community the contribution by the unsung heroes of Kerala, who were the ones who actually saved the lives of people in the floods which devastated our state. And another message is that as we are all trying to working together to equip ourselves to fight the issues of climate change and be more environment friendly, but in situations like this, when there are extreme emergencies, when the system itself is clueless about where to begin, the people, it can be the common man with that experience of dealing with the fury of nature, can be the savior or can be the leader, and their role should never be underestimated. Thank you.
And thank you for honoring them as you did also at the beginning in your comments on former WHO staff. Maria, I also have a question for you. You know, the point that was raised to my left was about this disconnect between, I think from Luke, from the energy and the health sector. And there's always, everyone always goes back to the finance ministry and how do you get them onto your side? How do you win their support? How do you get them to fulfill your budget to allow you to do what you need to do? Why is it so difficult? And then perhaps you could weave that into a narrative on what stood out for you here today and what you're going to take back to your team around the room and further work on.
That was a very easy question, James. Thank you very much for that. I will remember next year when we will be organized panels like this one. Okay. I think we need a very strong narrative. You heard it from all the places during this week. You heard it from the interventions yesterday during the discussion about the global strategy on health, environment, and climate change. The narrative is there. I mean, the arguments, the evidence, all the key pillars are perfectly aligned now. We just need to change maybe a little bit the tactics in terms of communication. We need to make sure that the health voice is very well articulated with very clear messages. So we need to align and say, okay, all of this is about basic public health interventions. Access to safe water and sanitation is something strange. What we are saying here is the basic of the basic. Access to safe and clean energy is the basic of the basic. And then we need to infiltrate the political opportunities. I'm so happy that now the Climate Summit and all the COPs are talking about health. Not the planet, not the polar bears, but about our lungs, about our brain, about our cardiovascular system. Those are the messages we need. I think the word asthma has been done more for all of this agenda than anything else. You know why? Because asthma connects people to the reality. They understand that if they breathe something that is toxic, the lungs will be affected. As simple as that. The representative of the International Federation of the Red Cross was saying that yesterday. What that means for me, it means my health. And that will be mobilizing people. The argument for the ministers of energy is very clear. If you do the right investments on the right sources of energy, you will have an incredible economic development, but more important than that, your people will be healthy. So the countries who will choose the right source of energy, now, those are the winners in the race. So not only for health, for social and economic development, we need to tell them that. Invest on green energy, sustainable energy, and you will have incredible benefits for health. So James, the response, I don't know, because otherwise it would be a Nobel Prize or something like that, but the communication, the narrative, and the health argument for the energy sector and the climate discussions, including the air pollution into all of those arguments, will be the fantastic way to promote this healthy energy transition, the healthy urban planning transition that we need, the healthy mobility transition we need, and health is the one that will connect everything. So the positive part is that the movement is coming from so many places, James, from journalists. I saw your colleagues, journalists, now so excited about air pollution and asking for clean air, big campaigns about that. I saw the policymakers starting to understand that this is about common sense, and it's about an economic revenue, and it's about votes. People will vote for them because this is popular, this is positive. And of course, the public health community is more and more excited and engaged, leading by example. More ideas will come. And the World Health Organization is so committed. So what else? 2 words, ambition and speed. We need to increase the level of ambition dramatically, and we need to accelerate the vitesse here, the speed. So you want me to keep talking because I can do it.
You raised that very important point where you talk there about the journalism. There is no greater time than now. Your moment is now, because people outside of this room are talking about what you're leading on. And you don't need to convince them to talk about it. I come previously from that field. They are so frightened by what's going on now, very, very late. I know it. It's super late for them to get frightened about it. But whether you're in China talking about air pollution or soil pollution or water pollution, it's now become such a mainstream issue because they don't want their children to be affected. They don't want them to be impacted that way. So what Maria said was really right, was that I know that you've all been giving decades in many cases of your life to this, but outside your work is beginning to really pay off because people are essentially quite self-interested. And they're quite selfish. So now that they see that their families are going to be affected, then they start to move. So if you go to China, which I'm sure many of you do, this is just one example because I lived there, and because the stakes are so high over there as well. When you go out and you see this dirty sky, when you go there and you don't want to put on the tap because you know that it's probably not a good idea to drink tap water there, when you're not quite sure about whether that is organic because you're not really sure what soil, what was on that site before it became a farm, then people have taken this from a climate, from a green conversation to just a family discussion. That's all it is. Maria?
I was so pleased when Luke was referring to this famous meeting in Nairobi with everybody was coming from the energy sector or something related to that, and I was the only one from the health sector. And they were referring to me saying, you as health professional, and I said, no, you are wrong. You are all health professionals. Because at the moment, the decision of the ministers of energy are critical for our health. So they are probably the most critical now on the decisions they are taking on the sources of energy will impact our health in such a way that I nominate all of them in the name of, of WHO, kind of honorarium ministers of health, because they have incredible, Luke is still laughing about that, because for me it's true. And the same now to ministers of finance and those involved on climate change. Those involved on climate change, on environmental issues, they are by default health professionals, because their decisions will contribute negatively or positively to our health. So they better watch out, because we will be counting the health consequences of that.
Maria will be available after this session for non-religious baptisms as well. But we are in a baptism of fire over here, and I think that you remind us of all the big opportunities. And I think, Maria, if I'm correct to say, and to borrow some of your thoughts, don't think of yourself here only as health workers. Think of yourselves as representatives of people and representatives of the communities who've elected you to represent them as well. Thank you very much to Dr. Maria Neira and Dr. Naoko Yamamoto, who I neglected to say was leading on UHC as an ADG, and she's now been given a very important mandate as the new ADG on healthier populations. You're going to wrap it up for us today.
Thank you very much. And I think nothing to so much to who still exist to add it. But first, let me say, first, honorable ministers, panelists, and speakers, thank you very much to join, and also thank you very much, all of you, for your participation and gems. Thank you very much for moderating. So, everybody, now we understand that the UHC cannot exist if the health facility doesn't have electricity, basic water, sanitation, hygiene, as well as management of the waste. At the health facility, we are health workers and public health workers. Healthcare facility should be green, and sustainable, and climate resilient. This is we agree. But also, we understand in addition to that, health care facility need to contribute, mitigate the risk or negative impact of global climate change and environment issues. So we should work for the health for people globally. So how we can do? That's what we discussed. And we heard the importance of dialogue, political momentum, and push people to work. But also James exactly said that DG said that we can start some concrete project and issues, even though it's not perfect. And innovation and new technology is also a new key. So I really appreciate share your views and show reality in the ground. But as WHO and with other partners, we would like to continue to work for it, for the health, for the people. So thank you very much to join us.